MCQs number 1. Which blood vessel is the main site of nutrient and gas exchange? Option A. Arteries. Option B. Veins. Option C. Capillaries. Option D. Venules. So the right option is option C. MCQs number 2. Which hormone is responsible for increasing blood volume and pressure? Option A. Insulin. Option B. Cortisol. Option C. Aldosterone. Option D. Melatonin. So the right option is option C. MCQs number 3. What is the normal average adult heart rate? Option A. 40 to 60 bpm. Option B. 60 to 100 bpm. Option C. 100 to 120 bpm. Option D. 120 to 140 bpm. So the right option is option B. MCQs number 4. Which structure separate the left and right side of the heart? Option A. Septum. Option B. Atria. Option C. Valve. Option D. Myocardium. So the right option is option A. MCQs number 5. Which of the following is the relaxation phase of the cardiac cycle? Option A. Systole. Option B. Diastole. Option C. Contraction. Option D. Refractory period. The right option is option B. MCQs number 6. Which condition occurs due to reduced blood flow to the myocardium? Option A. Hypertension. Option B. Myocardial ischemia. Option C. Aneurysm. Option D. Bradycardia. So the right option is option B. MCQs number 7. What type of blood is carried in the pulmonary arteries? Option A. Oxygenated. Option B. Deoxygenated. Option C. Mixed blood. Option D. Arterial blood. So the right option is option B. MCQs number 8. The term bradycardia refers to option A. High blood pressure. Option B. Low blood pressure. Option C. Low heart rate. Option D. High heart rate. So the right option is option C. MCQs number 9. Which valve is located between the right atrium and right ventricle? Option A. Mitral valve. Option B. Tricuspid valve. Option C. Aortic valve. Option D. Pulmonary valve. So the right option is option B. MCQs number 10. Which of the following is not a function of blood? Option A. Transport of nutrients. Option B. Temperature regulation. Option C. oxygen exchange. Option D, control of digestion. The right option is option D. MCQs number 11. Which blood vessel have valves? Option A, arteries. Option B, capillaries. Option C, veins. Option D, arterioles. The right option is option C. MCQs number 12. The primary function of white blood cell is option A, oxygen transport. Option B, clotting. Option C, immunoresponse. Option D, nutrient transport. The right option is option C. MCQs number 13. What is the main factor that regulates heart rate? Option A, respiration rate. Option B, blood pressure. Option C, neural and hormonal signal. Option D, blood glucose level. The right option is option C. MCQs number 14. Which blood component helps maintain blood volume by retaining water? Option A, hemoglobin. Option B, platelets. Option C, plasma proteins. Option D, red blood cells. So the right option is option C. MCQ is number 15. Which structure in the heart is primarily responsible for delaying the electrical impulse to allow the atria to contract? Option A, SA node. Option B, AV node. Option C, Purkinje fiber. Option D, bundle of His. The right option is option B. MCQs number 16. Which type of vessel has the lowest blood pressure? Option A, arteries. Option B, capillaries. Option C, veins. Option D, arterioles. The right option is option C. MCQs number 17. What initiates the heartbeat? Option A, AV node. Option B, Purkinje fiber. Option C, SA node. Option D, bundle branches. The right option is option C. MCQs number 18. An increase in blood vessel diameter is known as option A, vasoconstriction. Option B, vasodilation. Option C, ventriculation. Option D, angiogenesis. So the right option is option B. MCQs number 19. The superior vena cava brings blood from which part of the body? Option A, lower body. Option B, lungs. Option C, upper body. Option D, heart muscle. So the right option is option C. MCQs number 20. A complete heartbeat is known as option A. Systole, option B. Diastole, option C. Cardiac cycle, option D. Heartbeat rhythm. So the right option is option C. MCQs number 21. Which condition is commonly known as heart attack? Option A. Stroke, option B. Myocardial infarction, option C. Arrhythmia, option D. Cardiomyopathy. So the right option is option B. MCQs number 22. The blood flow in veins is mainly aided by option A. Muscle contraction, option B. Gravity, option C. Blood pressure, option D. Arterial pressure. So the right option is option A. MCQs number 23. Which valve prevent backflow into the left ventricle? Option A. Pulmonary valve, option B. Mitral valve, option C. Aortic valve, option D. Tricuspid valve. So the right option is option C. MCQ number 24. Which vessel connect arteries to veins? Option A. Capillaries, option B. Arterioles, option C. Venules, option D. Lymphatics. The right option is option A. MCQ number 25. The major ions responsible for generating the action potential in the heart. Option A. Potassium, sodium and calcium. Option B. Chloride, sodium and potassium. Option C. Sodium, calcium and magnesium. Option D. Calcium, phosphate and magnesium. So the right option is option A. MCQs number 26. Which hormone causes blood vessel to constrict rising blood pressure? Option A. Epinephrine. Option B. Insulin. Option C. Serotonin. Option D. Melatonin. So the right option is option A. MCQs number 27. The fluid filled sac surrounding the heart is called option A. Myocardium. Option B. Epicardium. Option C. Endocardium. Option D. Pericardium. So the right option is option D. MCQs number 28. Which term refers to the amount of blood pumped by each ventricle per minute? Option A. Cardiac reserve. Option B. Stroke volume. Option C. Cardiac output. Option D. Heart rate. So the right option is option C. MCQs number 29. Coronary arteries supply blood to option A, brain, option B, lungs, option C, heart muscle, option D, liver. So the right option is option C. MCQs number 30. Which part of the heart has the highest pressure during systole? Option A, right atrium, option B, left atrium, option C, right ventricle, option D, left ventricle. The right option is option D. Thank you for watching. Please subscribe my channel for more medical related information.